Well, good afternoon, everyone. It is right around the top of the hour. We're going to give everyone about 60 seconds to get logged in, and we'll be underway. Thanks for joining us today. All right, well, I think we will go ahead and get started. It's great to have all of you with us today. Thanks for taking the time to join us. We're just so glad you could be with us this afternoon. My name is Dan Worry. I am the Senior Director of Early Learning at the Hunt Institute in Durham, North Carolina. If this is your first visit with us, and it looks like that may be the case for some of our registrants today, the Institute is an education policy resource. We support governors and state legislatures primarily around the country, founded by four-term North Carolina Governor Jim Hunt. This is the fifth installment of what has become a really popular conversation focused on early childhood philanthropy, and one that we have really been looking forward to because of the panel that we have got together today. As you have probably gathered from the title, Early Childhood Philanthropy Amidst COVID-19, we created this series in part to allow our philanthropic partners to talk a little bit about their work under what are, we know, a very unique set of circumstances caused by the pandemic. But there are other important things that are happening during this time. Certainly over the past year, we have had many important conversations about racial justice and equity, and some of those topics have been sort of further exacerbated by the pandemic. We have just wrapped up a particularly divisive political season as well. And so the issue here is really not so much simply COVID-19, but how we as a field in early childhood are helping to support children and families through what we know is an unusual and frankly a stressful time. So it is great to have all of you with us, and I want to introduce our panel. I know they've got great things to share. We are joined today by Ellen Roche, who is the Executive Director of the Trust for Learning in Washington, D.C. Also by Meka Sales, who is Director of Special Initiatives at the Duke Endowment in Charlotte, North Carolina, and Monica Hobbs Vinluan, who is Senior Program Officer at the Robert Wood Johnson Foundation, which is based, as you may know, in Princeton, New Jersey. But Monica joins us from the DC office, or probably the home office right now of Robert Wood Johnson. So anyway, it is terrific to have all three of you with us today. I think as we kick this conversation off, I want to start as we sort of have throughout this series, and give each of you an opportunity to share a little bit. First, maybe a chance to introduce the work of your respective foundations to the audience, but then to reflect a little bit with us about what has changed in your work over the past year, or have priorities changed internally in terms of funding? What are you seeing from grantees, and how is it sort of pushing your thinking in new directions during this time? So with that, maybe Ellen, why don't we open it up with you and Trust for Learning.
Hi, everybody. Really good to be here, calling in from DC. So Trust for Learning is a philanthropic partnership. We are a group of funders who work together on our shared mission, which is to expand the highest quality models of early childhood from birth through age 8 to serve our most underserved and vulnerable kids, and to do that as often as we can using public dollars. So our mission hasn't changed, in the context of the pandemic, and we work through 5 kind of big strategies, which also have not changed, and I'll just run through them really quickly to give you context. But we really kind of shifted our tactics, both in kind of response to the realities of virtual learning, the momentum and sort of moment around racial justice, and some of the work that we'd already been doing. So big picture, we work kind of in 5 big areas: movement building, expansion of these high quality ideal learning models through Head Start, policy change, networks of practice, where we support the first ideal learning district in the country, New Haven Child. And then the 5th one, which I'll talk a little bit more about, we call ideal pathways. So in the ideal pathways work, we're really trying to kind of pull back the curtain on really high quality early childhood models to look at how our teachers prepared, trained, sustained in these models. So very long story short, and happy to share more about this in Q&A or as follow-up. Pre-pandemic, before COVID was even like a word that we knew, we had partners from the Ideal Learning Roundtable, which is a group of experts, really pedagogical experts in early childhood and child development, working on a report looking at 11 different early childhood approaches and looking sort of behind the scenes, how are educators recruited, trained, prepared, supported, and really trying to look across these 11 approaches at factors related to access and equity for educators of color. So specifically looking at, do these training models cost money? We found some that were free or subsidized. We found others that were, a master's degree for $50,000 plus. Do they result in a credential? What's the format? Do you have to go somewhere in person to participate? So anyway, we looked at all of these, or our partners looked at all of these factors and then made a number of recommendations for funders, for policymakers, for researchers. That came out in August, and we then launched a grant fund, the seed fund, supporting equitable educator development, and tried to bake 2 additional things in given the pandemic. One was layering racial equity as much as we could through every step of the grant making process, from how we wrote the kind of description of our objectives to how we reviewed grants through community panelists, all the way to the grants themselves, which I'm happy to share more about, but I want to stop there for the sake of time. But so yeah, tactically we shifted quite a bit, and we're trying to sort of figure out, is there a silver lining related to virtual learning that educators could use right now? So it's good to be here, excited to learn from everybody else.
Ellen, thanks so much, and we'll dig into some of those topics a little bit more as we go on through the hour. But I'll shift over and introduce Meka Sales of the Duke Endowment in Charlotte. Meka, talk to us a little bit about what Duke is up to generally, and how maybe the past year has changed the work and the thinking there.
It is a wonderful pleasure to be with you all. Thank you very much for the opportunity to be with you, Dan, and others in the audience. I'm with the Duke Endowment here in Charlotte, North Carolina, and the Duke Endowment was founded by James B. Duke in 1924. So we are almost 100 years old, and we are an institution that serves primarily North Carolina and South Carolina, and we have 4 big program funding areas that we fund in. One is higher education, and there are 4 specific schools that we fund under our higher education work. We fund in the healthcare space. We also fund rural United Methodist churches in North Carolina only. And we also have an area called child and family well-being. And these are the 4 areas that Mr. Duke set up in 1924. I'm the Director of Special Initiatives, as you have heard. So you're probably wondering, well, where do I fit in? Well, about 3 or 4 years ago, the endowment began to think more deeply around early childhood more broadly, and to all of us were understanding the research coming out of Harvard around the brain science and child development. And so we took a leap to do a little bit more work in the early childhood space more generally. And so I oversee a body of work on our place-based investments around early childhood. And one of our major investments is in Guilford County, North Carolina, where we are working with a backbone organization called Ready for School, Ready for Life, and community partners to build a responsive and innovative early childhood system that we think will produce outcomes of a population level change for generations, hopefully to come. So we're focusing on prenatal to age 8, and we're kind of throwing everything we know to do at early childhood at that space. So take our 100 years of working in the sector in the North and South Carolina, and we are efforting that towards our work in Guilford County. So this is a long investment that we're making. It's a 10-year plan, and when COVID hit, we were 2 years into that plan. And I would want to say that because the commitment was so strong for building this innovative system, that we are continuing on with those strategies. But just like everybody else, we've had to reckon with what's going on in the country around racial equity and also with the COVID pandemic. So under new leadership at the Backbone organization, those group of partners are engaging and everyone's improving their education around racial equity. And we know that we need to embrace that value of equity and to understand what it means, how race is racialized in our country, how it operationalizes in our country, and what ways we can use to utilize what we learned there to, as I like Ellen said, layer on those strategies onto the core pillars of the work that we're doing in Guilford County to improve outcomes for kids so that we cannot predict them any further just by their demography. Dan, you also asked earlier, when we were thinking about how the work has changed and what's shifted over the year. And as I reflected on that, I just thought about the fact that I saw a quote recently that said, questioned whether we are working at home or whether we are living at work. And for many of us that are living at work, that's a privilege, right? If we're able to work from home, because we know that many people, including our friends and our neighbors and our community members, had to go out into the world from day one of this pandemic and to make a livelihood for their family as well as maintain our economy. And we know that those livelihoods were in service of us and for the maintenance of our economy. And so one thing I want to say as I reflect, and I'm seeing this in our own work at the endowment, is that the cause of the pandemic and the reckoning with racial equity and racial justice has caused us to really understand what it means to get proximate. So we hear Brian Stephen talk about proximity, and I know now either you get close to it or it's coming closer to you. So we have gotten proximate, and with that proximity, you can no longer create distance between you and other, right? And so we are now understanding how we need to personalize what's happening. And it's not just what's going on out there, it's what's happening to all of us and to our communities. And I believe once we get proximate and we understand that personalization of it, then we can empower ourselves and we can understand what we can do individually, collectively from our communities, and also what we can do as a collective body and sector to act in this way. So I just think that there's lots of I look forward to having the Q&A, Dan, as we go forward, and to talk a little bit more about how we're seeing the resilience of our communities, particularly the work that I'm doing in Guilford, but also throughout the Carolinas, as COVID has come in, has revealed lots of inequities, lots of unequal treatment, and how family voice and engagement is really being a place that we're pointing to and learning a lot more from so that we can empower families to achieve the best outcomes for themselves and for their children.
Meka, thank you. And your reference to the Q&A reminds me of two maybe quick housekeeping things that I neglected to mention at the top of the hour. We will take questions from the audience later in the hour, and so we invite you to use the Q&A function there at the bottom of your screen on Zoom to enter any questions you might want to share with the panel. The other thing that I wanted to mention that you probably see on your screen as well as a prompt, but I'm excited that we're able to do it, and so did want to mention to you that we do have the option of using closed captioning today and increasingly on all of our webinars. So if that is a service that would be useful to you, please know that it is available, and you can click on the closed caption icon at the bottom of the screen as well. So with that, why don't we'll turn to the Robert Wood Johnson Foundation. Monica, you want to share a little bit about your work?
Yeah. Hello. Good afternoon, everybody. Thank you so much for inviting me into this conversation. I'm really delighted to be here and also to get to be a panelist with my two colleagues here. It's just delightful. So at the Robert Wood Johnson Foundation, we are working to really help to broaden the discussion about what shapes health and to hopefully set a new standard of health, equity, and well-being for all communities. You might have heard for many years now, we've been working to create a culture of health in this nation where everyone, regardless of where they were born, how much they earn, how much education they have, or what their racial background is, that everybody can live the healthiest life possible. And as we all know, that health impacts every element of our lives, from where we live, learn, work, pray, and where our kids play. So just to provide a little bit of context for those of you who are not familiar with the Robert Wood Johnson Foundation, we have 4 major areas of programming. One is around our transforming health and healthcare systems. Another is around leadership for better health. The third is healthy communities. And the fourth is healthy children and families. My work lives, if you will, in the healthy communities portfolio, as well as in our healthy children and families portfolio. And is in that last portfolio that the majority of our work in the early care and education sector and field sort of resides. And so to pivot to the question about what changes we're seeing in this over this last year, you know, we have always known, and we as a nation know, that disparities in health outcome have always existed in this nation. But what the last year has shown us with the COVID-19 pandemic and the racial awareness and reckoning that has happened, it's really given us a heightened understanding of that, and a heightened awareness and a deeper understanding of how structural and systemic inequities are in the lives of so many people in this nation. So for us, the pandemic has really led us to lean into, even to a larger extent, in a commitment to advance equity and to identify new pathways to address these inequities. What we have done is we've changed a lot of our existing processes for how we work with our grantees to really help hopefully respond to the challenges they're facing, the realities of what it's like to do, for example, policy and advocacy work in a virtual setting, to host convenings in a virtual way, and really to try to be as flexible as we can around deadlines and budgeting and those types of things. But aside from how we've been working with our current grantees, we also recognize that it will take us many years to emerge from this pandemic. Even though it took us, a short period of time to find ourselves as a nation in this pandemic, it's going to take many years for us to get out of it. We anticipate that we're going to be only continuing to ramp up our funding to address systemic racism. We're going to continue our work on building and increasing community power. We've long been invested in changing policies and practices, and also in rebuilding our public health infrastructure, which is now even more pressing. And there's a greater awareness about the role public health plays in our nation at this time. So those are the areas that we're going to be continuing to expand upon.
That's terrific. Monica, talk a little bit more about obviously the pandemic has brought to light a lot of issues related to health equity, as you mentioned, which of course has always been sort of a major focus of the Robert Wood Johnson Foundation. But are you seeing specific equity concerns that are coming up in the context of the pandemic itself, and what is the foundation doing about those?
Absolutely. Thanks for the question. So there's sort of 2 things that come to top of mind, and I'd love to address them both. But first, I want to start with just definitions, because there's a lot of conversation, a lot of awareness around equity, and there's a lot of different understandings, and as well as different definitions that folks use when they're talking about health equity. So for us at RWJF, health equity means that everyone in America has a fair and just opportunity to be healthy. This requires removing obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness and lack of access to good jobs, fair pay, quality education, access to early care and education, housing, environments, and healthcare. So those are those issue areas that we're focused on as a foundation in order to try to achieve health equity, and to actually try to get us as a nation closer to achieving that goal. So our grant making is focused on all those issue areas. And now to answer your question, the top 2 things that come to mind, one is on the daily news, and everybody's talking about it, and hopefully many of folks on this call have loved ones that are either in line to get a vaccine, have gotten their first or second vaccine, or they're trying mightily to get that vaccine. So for us, we've been spending a lot of time as a public health foundation thinking about vaccines and vaccine hesitancy. Um, Now, in the rush to get as many people vaccinated against COVID-19 in the United States, we've really become obsessed with numbers. We've become obsessed with how many doses have been distributed, what percentage of people need to be vaccinated to reach herd immunity, and there's so many other stats that we're focused on. And we as a foundation feel like there's another stat that we really need to be thinking about, and another priority around equity that we need to be centering. Um, the nation has lost sight of the fact that while this pandemic is affecting every community, it is not affecting every community the same. Black, Latino, and Native Americans, many of which who are frontline essential workers, are being infected, hospitalized, and dying at rates that far surpass their proportions of the population. So given this reality, we must do everything that we can to ensure that more of them get to the front of those vaccine lines. So that's an equity issue that we're spending a lot of time and energy on, really trying to make sure that we're collecting data on race, ethnicity, and occupation and neighborhood from every state. And we're helping to develop and create those systems in this nation around making sure we have accurate data. So that's one thing that is really, really top of mind every single day as a foundation for us. And I'm just going to say for me personally, as a daughter of a daughter of parents who just now got their second dose yesterday. So the other issue around equity and bringing it more close to home to this conversation, if you will, around early care and education. We know that all providers of all sizes and all settings and in every community have been really negatively impacted by this pandemic, and they all need different types of support. And we also know that across the childcare sector that 1 in 6 workers have lost a job. We've also are hearing information from groups like the Chamber of Commerce that really recognize that without the industry's survival and ability to safely care for children of working parents, every other American industry will struggle to return to work. So clearly the recovery of our country depends on the stabilization of the childcare industry. So the system has long suffered from a lot of different inequities, as we all know, but the pandemic's devastating impact has really shown a spotlight on these disparities. We know that virtually all childcare workers are women in the formalized systems. Disproportionately, there are also women of color and immigrant women who don't have adequate wages or benefits. And we also know that 45% of childcare workers are Black, Asian, Latino, and half of the childcare businesses are minority owned. So we must really, in order to build back this nation, we really must focus on equitably building back the childcare workforce and providing them the resources and supports they need. So part of our grant making is really focusing on reducing these inequities in the childcare system. And I should also point out when I'm talking about the childcare systems, I'm giving a lot of stats around organized and, if you will, provider-based childcare. And I'm talking about providers of all types. So even those that care for children in their own home, or whether they're even caring for their own children. So these are caregivers of all types that we need to be thinking about as a nation in order to create and rebuild a more equitable economy.
Monica, thank you. Meka, I want to turn to you with kind of a similar question as you're approaching your work. I mean, and I think of the work in Guilford County in particular. I mean, you mentioned that you kind of have a plan to comprehensively address and kind of throw all the good things that we know, to these families in need. But obviously, the past year has changed very much the way that school and work and life look for those families. What sort of trends are you noticing in your work in the Carolinas right now, and how is the endowment working to address maybe those new realities?
Yeah, I think Monica really set the stage really well here to really centering the fact that if we want to rebuild back our economy, we need to rebuild the early care and education system, which is a really noble and grand effort and a wonderful opportunity that we all have, because we all know that it's a system that is woefully underfunded and undervalued. In Guilford County, as you say, Dan, we are really thinking about early care and education, or early care, and broadening our definition really of early childhood, right? Like in years past, we've thought about early care as just what's happening in that child care center, but now we know, and we are expanding our thoughts and our work around what's happening at the pediatric office, what happens in pre-K, what happens in communities, what's happening just in the family environment. And so we're working towards building supports that navigate folks to resources as they need them, regardless of their demographics, because face it, we all know that when you're a new parent, you don't know what you're doing. And so we are making those resources trying to make those resources more available with navigators. And we're learning that parents of color, we know that there are more barriers to them accessing the system, but through more research and qualitative data gathering, we're learning what are those barriers, and some of those are systemic. Some of those stem from systemic racism and misuse and unequal treatment. So we also have to collect, and expand our thinking around data, and understand and broaden our questioning around qualitative data, and understanding and listening and embracing and integrating what families tell us that they need. We also are working towards improving the the um, the prospect of quality in this amongst all early childhood providers and providers in the community that touch children. And so, spurring a practice of continuous quality improvement so that they can become better at delivering trauma focused care, deliver better care with families, and engage families in a more systemic and high quality way. So we are seeing that the pandemic is also, has disaggregated some of these services and really disconnected people, but it's really the voices of the community, and making sure that you are engaging those voices of community to help you fill in those gaps, and then to listen and take in that information and build it back better. That's our opportunity in Guilford as we design, and we have the opportunity to look ahead and plan and effort with others to put this system together. We're able to take in that family voice, really incorporate it into the design elements and the strategies that we're efforting towards. The last one I want to mention is around data and integrated data systems, and helping figuring out a way that providers from the pediatric office to the home visiting program to the school system eventually can all, and parents and families can all see their data, own their data, and understand what services they need and where they have access to them, and be connected to resources in a more timely, systematic way.
Great, Meka, thank you. Ellen, I wanted to ask, I've actually been looking forward to asking you a little bit about ideal learning. I don't know if everyone in the audience is aware, and would definitely refer them to the Trust for Learning website to learn a little bit more about the great work that you're doing there. But the Trust is so well known for this focus on these curriculum models, which are whole child and equity focused, include some of the field's really most respected models: High Scope, Montessori, Reggio Emilia, just to name a few. So obviously the Trust has had this great focus on these creating these ideal classroom environments, and here we are. Now we were just talking about how we're almost a year now into pandemic world, and the irony isn't lost on me that a little over a year ago there was a lot of conversation in the field about this question even of online pre-K, right? And so there was about a year ago, I think many of the most prominent voices in the field really weighed in and said, there's no such thing. You can't have online pre-K. There's in no way is it a replacement for a classroom experience. Completely inappropriate. And yet here we are, a year later, with that being just by happenstance very much the reality for a lot of kids around the country. So how has the pandemic sort of shifted your thinking on the ideal learning front? And is there a way for us to incorporate ideal learning in sort of a distanced way right now?
Yeah, so this is it's a great question and a really hard question. And I'll just pop a few resources into the chat in case folks want to learn a little bit more about the thinking behind kind of the principles of ideal learning and how they show up in different early childhood approaches. So when we typically, the principles themselves include equity as the first principle, a commitment to play-based learning, the environment as a critical teacher in many cases. So of course, that's a big one that we're thinking about right now. So I think in terms of the pandemic and sort of how it's impacted these aspirational goals for how children are supported to learn from birth through age 8. So we try to take a sort of comprehensive early childhood approach. I think, like so many other ways that inequity manifests in our society, it just depends so much on where you're starting in terms of power, privilege, resources. I was speaking with somebody yesterday and their Montessori school never closed. Their kids have had some version of in-person learning since last year. I spoke with another woman a few weeks ago, and she lives on a reservation, and their early childhood center closed a year ago, and she never heard from them. Right. So like so many other things, sort of where you're starting and then this population level experience that we're all having, I think is going to determine sort of what it looks like in the future. But on the more positive side, I think what we're seeing, what I'm observing in my friends and colleagues is that, as I think we've always sort of known, educators and parents and kids are creative and scrappy and resilient. And I think that in many ways, there are learnings that we're kind of discovering that may outlast the pandemic itself. I heard from a friend who's an elementary school teacher the other day that this was her first year ever where she got to have a substantive parent-child parent-teacher conference. Right, she could do Zoom, and it was so much easier for parents to access to have that kind of substantive conversation with her. So and like we're doing with our seed fund projects, many of those are taking advantage of virtual learning, right? So Montessori teacher training has typically been full-time in person at a specific location, right? And all of the Montessori training centers around the country, as are all of these other models, are figuring out, well, what can we actually do online without sacrificing, right? But what can't we? And I think that's the other important question. So all of that is to say, I don't have like any excellent answers, but I just want to reiterate a couple of the things that Monica and Meka said, which are, I hope that this will be the moment for a real reckoning around compensation and like deep investment in this both system and non-system that is supporting babies, kids, families, our entire economy. So that is my hope, that this will be sort of the final push that we need to have that reckoning. And then another thing that we're hopeful about in terms of sort of the national conversation. So a colleague from the Ideal Learning Roundtable, our sort of pedagogical experts, I think it was like May of last year, right as everybody was deciding, okay, we're not going to do standardized testing, she said, my whole career, we've been fighting about, standardized testing. This is our constant sort of dilemma and tension and, challenge in education. And like that, it's gone, right? And what is left? Like, what are the essentials that are left when the infrastructure, disappears? So I think we're also due for a kind of new conversation about assessment and measurement, about what really, really matters in early childhood. The final thing I'll say is, so the principles of ideal learning, and a lot of the work that we did on the kind of pathways or educator front last year has really reinforced for me the idea that early childhood systems should be about human development. They should center and support babies and children, but educators should thrive in these systems. Parents should benefit from these systems. And we're all going through this huge thing, right? So I think, I can't remember Meka or Monica who said it, but bringing those sort of deep trauma-informed practices, not only for kids, but for ourselves, so that we can be present and self-regulated and support, our communities through this, is probably the most important thing. So I worry that we will focus too much on other really important things like learning loss and the big inequities, which are really important, and not remember that like fundamental care.
Thank you, Ellen. I want to follow up on something you said there, because it actually dovetails nicely into a couple of the questions that are in the chat. And again, I remind everyone, if you have a question for the panel, please feel free to enter it into the Q&A function. But we were talking about the early childhood workforce a little bit, and I think a couple of themes have come out, I think, of the pandemic. I think on the one hand, we've got this early childhood workforce that is now maybe spoken of with a new sort of reverence, right? That we're thinking of early childhood teachers as first responders and kind of lifting them up, and especially early on in the pandemic, lifting them up in the same light, with firefighters and medical personnel who are essential to the response to the pandemic. So it seems like on one hand that we may be helping to develop a little more respect and for the workforce, but on the other hand, the workforce is emblematic of really one of the greatest, if not the greatest, inequity in early childhood, which is the child care workforce in particular, which is comprised primarily of women of color, underwrite the affordability of even service provision across the country in the form of terrifically low wages. And I think the pandemic then also highlighted frankly dangers to that workforce, right? So we had school systems that were saying it's not safe for us physically to meet, and that risk wasn't eliminated by shutting the schools. That risk was actually shifted onto this early childhood workforce in a lot of cases that are working in childcare settings. These are primarily women who are making very low wages that very well may not have access to employer compensated health care. Here we're asking them to work through this contagious pandemic, a workforce that in lots of cases doesn't even have the opportunity to take a paid sick day. And so wanted to sort of combine a couple of questions out of the chat and let you all have an opportunity to sort of talk to some of the inequities with the early childhood workforce, and in particular, what might we do, and what role might philanthropy play in helping to uplift that workforce and to narrow the gap on compensation. Anyone want to jump in?
We're all pausing because what a meta and important question. I will start, not completely and fully answer, of course, but lean on my colleagues as well. I think it goes back to something that Ellen said around how do we center the needs of our caregivers. I think that there's been an ongoing process and decision making and policies and practices that have been put in place that do not prioritize the needs of caregivers in those decisions. So one of the things that we've been really thinking a lot about and even helping to support and fund is the organizing efforts of caregivers, and how do we think about making sure that they're well supported, not just financially and economically, but actually that their emotional health is supported, that in this debate and conversation, as I was talking about vaccines earlier, about who gets the vaccine and who goes first, like if we were talking about our early learning and care providers as essential, and yet in some jurisdictions, they're not even on a priority list. So there's some inconsistencies there. So to get to this issue, I think it's around helping support building their power, organizing, helping to making sure that decisions and solutions are actually centered by their desires and needs and realities, actually, because the economic crisis has hurt millions and millions of Americans, but has disproportionately hurt women, and even greatly more disproportionate harm to women of color, as we already talked about, who are predominantly the workforce in the early care and education system. So I think that is part of the solution, is how do we make sure that we're not making decisions for workforce, for the workforce and for the providers, but actually that the care providers are actually telling us as a nation what it is that we need to do to solve these problems. So that's a start.
I'll jump in. Monica, thank you for going first because we were, as you said, that was an important and large meta question. And I think part of the data gathering here is just understanding who they are, who's out there delivering the care, and where are they. And in addition to organizing, helping, and maybe even thinking about coalition building with other familiar or like-minded organizations. I know that we can point to the Domestic Workers Alliance and the important work that they have done. And I know of some some childcare providers that are kind of getting linked into that network, but that may be, I'm just thinking out loud, that might be an important coalition and group to strengthen connections too, because there's a lot of similarities in that work, and probably the policy solutions could be beneficial for both. And I think, where we also can give voice, perhaps visibility to those warriors. They are warriors out there that are taking care and educating and providing great early learning experiences for our children. I know I benefited from being a mom whose provider didn't close. And so we've had that support over this past year, and it's been a lifesaver, literally. So where can we as an industry or as a sector lift up those voices and highlight the desires that they have? I'm pretty friendly with our provider, and I know she goes to every childcare network meeting there is in Mecklenburg County, and also she's even been on some of these national calls and seeking supports and resources. So they are hungry for a network and a platform, and so perhaps that's another space that philanthropy can be supportive of.
So I agree with all of that. And the one additional thing that we're thinking about this year in particular is around more, I mean, we do some, but more communications and storytelling work to, as folks have mentioned, really amplify and support the voices and needs of the people who are making this work, despite this incredibly difficult context. And I do think the sort of highest level mainstream messaging that I've seen during the pandemic about the role of childcare tends to really focus on its role in terms of getting the economy restarted, which makes sense as a sort of, the urgent need for many people is to be able to get back to work and kind of restart the economy. But I think we would love to see a more sort of like human-centered or holistic message about the role of early childhood educators, caregivers. We think a lot of the kind of messaging that's come out in the last 10 or 15 years about babies and toddlers and why we should be investing in and supporting and caring for them thoughtfully and well is also economic, right? Like the Heckman research was so pivotal, so important, but it's still about sort of like the payoff in terms of the economics. So really important to have that, but then also hopefully having that more qualitative side about caring for each other as humans, and babies and toddlers and young people being the center of kind of the system of care that works for everyone. So that sort of messaging piece, I think we want to try to support in some way with our partners in coalition, and just make sure that that's not lost in the shuffle of restarting.
Great. As we're talking about the early childhood workforce, Alan has helpfully noted in the Q&A, and I popped it into the chat so that everybody would have access. But the University of California at Berkeley publishes an early childhood workforce index, which is a fascinating document, one that we use very extensively every year to sort of tell the story of the circumstances of the early childhood workforce. And so it is definitely something that if you haven't taken a look at it, commend to your attention. Interesting question from Susan in the chat that I wanted to raise, and she is asking about the trauma that so many adults have experienced during the current year and its sort of connection to early childhood. So she's asking, how are you thinking about identifying and funding models to support the challenges of the trauma that we're handling with adults and teachers and parents, so that they will be emotionally available to support their children. Any thoughts on that?
Seems like I'm always the fastest to get off mute. What pops in my mind is historically at RWJF, we've supported and helped to support a lot of the researchers around ACEs, adverse childhood experiences. One of the other and complementary areas that we're really leaning in and expanding our work is adverse community experiences. So we now are thinking about them as the twin ACEs. So adverse community experiences really get to the structural and systemic issues that really drive the disparities and the determinants of health, if you will. So part of what we're really thinking about is how do we, back to something I think Ellen named first, how do we think about trauma-informed practices in our approaches to not just designs of curriculum, but actually to policy solutions and advocacy approaches. So, so that's one thing that just pops in my mind, is around how do we really address and understand how individuals and families' lives are actually impacted and being driven by the community experiences that they're, as a part of the community that they're part of. So I'd encourage folks, maybe while others are chatting, I'll pull up a link to that. The twin ACEs, I think, is an interesting approach to how do we give voice to this.
Anyone else want to weigh in on that?
I can just weigh in. I think that we are noticing and observing, all of us, we're recognizing, particularly my colleagues that fund in our child and family well-being area, which has its roots in child welfare funding, that the incidences of reporting of child abuse and neglect were probably going to go way down, and not because they weren't happening, just they were going to be underreported. And so, because we know sometimes when children are in school or at other settings, that's where those reportings can happen. And so I think a recognition of that led to an opportunity for us to do something a little irregular in our foundation, which was we don't think of ourselves as a disaster funder necessarily, but I think everyone is doing some disaster relief funding right now with COVID. And we did amplify some of the work we were doing in response to COVID around some of our issue areas, child, family, well-being, et cetera. And so where there was opportunities to support and get resources to more underrepresented areas like kinship care, for example, or for families, or therapeutic supports, and getting more resources out to families right away during this crisis. That's not long-term and systemic, but it was an opportunity that we saw because of the need and the pandemic and exacerbating it, and I guess a way to try to mitigate it as best as possible while we still focus on some of our long-term systemic solutioning.
Great. Question from Joe in the chat, which is interesting. We talked about the sort of the limitations of online learning for young children, but one place that may that online may have sort of helped over the past year is in home visiting. Strangely enough, I've talked to a number of states where they have said that by switching to kind of a telehealth model or a virtual home visiting model, they're actually finding it easier to connect with families, that they are more willing to participate in home visiting programs, more likely to keep those appointments. So curious to know, Joe is asking whether you're using telehealth or virtual home visiting to support parent skills right now in early childhood.
Yeah, I can jump in, Monica, and give you a break. We, particularly in our place-based work, we have been longtime funders of Nurse-Family Partnership, another home visiting program and connecting program called Family Connects. is also a program that's been funded by the endowment for many years. And with our place-based efforts, we, and our funding mechanism, we kind of had some targets out there for both of those programs for last year, and they still, in a midst of COVID, almost hit those targets exactly. And I think it was due to being able to pivot fairly quickly to home visiting models that utilizing telehealth. So we saw a little break right there. Everybody had to kind of regroup and figure out what to do. But very shortly after that, telehealth became the way to provide services, and even some of our providers had programs where they were delivering devices to families so that to make sure that they had the access points to receive the home visiting services. So I think that's definitely one of those things where, Ellen, you talked about standardized testing and how we've always done that, and all of a sudden we didn't. And then now, not that we didn't, but now we have another focal point. But this is another thing. Telehealth has been something that we know has been around, but we always value the face-to-face and the driving out to the house and seeing it for ourselves. But when this pandemic revealed itself, we were able to switch to this technology and not really lose much quality. And in some cases, Dan, to your point, reach more families and have it a little bit more easier for families to connect and to receive the services and supports that they need.
Monica or Ellen, anything on that topic? We can jump on to other questions. I just don't want to interrupt. Meka, a question in the chat about the work that you were doing in Guilford County. Wayne is asking just to hear a little bit more about how that strategy came about and who are the key partners and stakeholders that you have engaged. Who funds the backbone and why you created a backbone.
Okay. I will be as succinct as possible, and thank you very much for that interest in that question. The strategy largely came about because our desire was to have put together a system that would produce, population level change, at the population level. And so we embarked on a couple of years of research to understand, to identify, I guess, what may not be happening in some of these early childhood system efforts going on around the country, and where could we, if we were able to, identify those areas of emphasis that needed to be implemented, could that get us our desired outcome? So some of those areas are things I've mentioned already around expanding programs that work, evidence-based programs. I've mentioned Nurse Family Partnership, Family Connects, Healthy Steps is another program, Reach Out and Read, for example. So expanding those programs to reach as many people as possible is a strategy. Creating a navigation service. I talked about how we have folks, we call them navigators, that are connecting folks, assessing at birth and other time points in the early childhood age range to connect them to services and supports. The integrated data system is a strategy that we are putting together, the continuous quality improvement, building that out amongst a network of providers. We have rigorous evaluation, and then also the backbone. And the backbone is key in collective impact efforts, so that you have one organization that is not providing services, but it is the convener, it is the collaborator, it is developing and holding the partnership together, and also leading the charge and implementing on executing the strategy. So the Duke Endowment co-created this strategy in essence with our backbone partner, Ready for School, Ready for Life. And we also are part of a national collaborative called Blue Meridian Partners, which helps to fund the entire effort. But the funding primarily comes to the Duke Endowment, is from the Duke Endowment, and goes to the backbone organization and to the community partners in Guilford County, as well as supplemented by the backbone's own additional fundraising efforts. So I hope that answers your question. To that questioner, I'd be happy to follow up offline if more information is needed.
Terrific. Thank you, Meka. I am always surprised at how quickly these hours go. I know we've only got a couple of minutes left. So I wanted to sort of wrap here with a question and give each of you an opportunity to respond a little bit. You know, we have been obviously talking you know, a good bit this hour about the current work, the kind of really urgent real-time work of the early childhood philanthropy field. But wanted to give you a moment here as we as we wrap things up to reflect on what you see as the future. Where do you see early childhood philanthropy heading, and what is your hope for the future of the field? Monica, maybe we start with you.
Sure. That's another great question, and ending on an optimistic note. I like that and appreciate that too. So as we all know, over the last year, it's presented families all across this nation with a lot of different challenges, but has also raised awareness about the current systems that we have in place. It really helped us to understand how early care and education is delivered, how it's valued, and how it's appreciated in this nation. We really, one of the things that we, as I mentioned earlier, that we're really trying to think a lot about is doing that hard look as to whether our current system is actually supporting all families of all types, and whether they're actually centering the needs of caregivers in all of those decision-making processes and steps. So we really see this opportunity and this crisis that we're in to build and transform a national early care system that really results in universal access around high quality, affordable learning opportunities for all children. We also see this opportunity, and we're not going to be able to get there unless we have a well-paid and well-supported workforce to provide that care. So our work at RWJF is really going to be help to thinking about ways that we can help to fill those capacity gaps so that organizing and advocacy and national organizations can all work more effectively together. So that's where we're focusing our attention on, around common narratives, common messaging, common frames, and really how do we center the needs of caregivers in everything that we're doing moving forward. We have a short-term problem, but we have a long-term fix we need to be thinking about.
Monica, thank you. Ellen, how about from your perspective as Trust for Learning?
So I think philanthropy has a lot of baggage, and as the country has sort of reckoned with racial equity and inequity, I think philanthropy has been doing that as well. I am very grateful to participate in the Early Childhood Funders Collaborative, and that group has been working really hard to try to wrestle both with the deep sort of racial inequities related to systems of early care and learning, but also within philanthropy. So I just encourage any funders who are on the call who are maybe less engaged in some of those questions, just inviting yourself into that kind of reckoning. Philanthropy, philanthropists, people who work sort of in this kind of realm, have a lot of power. And so anywhere that we can reckon with that, give up power, displace power, change power dynamics, I think we should. So I see that happening. I'm hopeful. I hope it moves faster. We are committed to that. We want to have a role in that. So that's one important thing. And then I think, to echo the comments that have been made so far, and a couple of things I saw in the Q&A that we didn't have time for, I think that early childhood can be a place of really visionary thinking about our culture, about the historic inequities and the present inequities that we have, and how we invest in a different kind of future and present for kids and families. So even though this is a really challenging time, and I think, Monica, to your point, it's going to be with us for a while, how can this sort of moment allow us to be really visionary and bold? So those are both very meta, but that's where I hope we're headed.
Ellen, thank you. Meka, we'll give you the final word.
I'm going to go even more meta, Ellen, and say it's been a pleasure to build off of this with Ellen and Monica and you, Dan. And where I'm seeing some movement, and where I think I'm really hopeful, is just broadly expansion. I think everyone is expanding their thinking about early childhood, like what is, it's not just early care and education, what is encompassed in social, emotional health and cognitive development and community environments and all of those things that we need to do. And I think I know we're all work with and see super smart people everywhere that are going to come up with wonderful strategies and tactics for us to keep testing and trying, because this problem is going to be with us, unfortunately, for a while. But what I am most hopeful about is that I do think, and I see philanthropy and other sectors and other agencies and organizations really embracing and identifying their values, because I think the values is what is going to keep us directed and our North Star towards what it is that we need to do. And I really also feel strongly that those values of transparency and of equity, and maybe reckoning is even a value, Ellen, is that are going to help us unravel these problems and create solutions, and really require us to put our money where we say our empathy is. And so that's something that I'm seeing and excited about: the expansion, the embracing of empathy, and the upliftment of the values that we all espouse, and living into those.
Well said. Thank you so much, Meka, and thanks to all of you for joining us today. And a special thanks to our panel: Meka Sales, Director of Special Initiatives at the Duke Endowment in Charlotte; Ellen Roche, Executive Director of Trust for Learning; and Monica Hobbs Vinluan, Senior Program Officer at the Robert Wood Johnson Foundation. It's been a treat to talk with all three of you today. Thank you for taking the time to be with us. I know we are just about out of time. I'm going to pull up quickly just to, if I can, all these online menus always end up in the wrong part of the screen, but I want to show you here quickly, just give a quick plug for two upcoming early childhood convenings that the Hunt Institute has on the way, starting next Tuesday, March 2nd, 2 p.m. Eastern. We're going to be partnering with the National Association of Elementary School Principals for a conversation about how to support elementary principals as early childhood leaders. Those of you who may have worked even in the elementary school system know that frequently those leaders come from backgrounds outside of early childhood. And so what do principals need to know, and how can we support them to be terrific leaders in early childhood is the topic of that conversation. And then looking into early April, we'll be talking about the challenge now of transitioning children who have been out of many group-based preschool and kindergarten settings back into school. We'll talk with Laura Bornfriend of New America, who has been leading some work on school transition, and a great panel of others to talk about how we get back and help support kids transition as they go back into school. Hope that you will take a moment to register for both of those. If you are registered today, chances are good you have received links to these, so we'd love to have you come and join us both in March and in April, and actually several other early childhood offerings sort of in the works for March and April as well. So stay tuned and we'll have some more announcements. Panelists, I want to thank you one more time. It's been so terrific to talk with you, and everyone, we appreciate you taking the time as always to be with us. Everyone have a great afternoon.